Good afternoon, everyone. Good afternoon. This is Dr. Madeline. I'm joining you this Sunday, today, July 12th, 2020. And today we're going to be talking about irregular menses. So thank you all for joining. I'm going to give us just a few seconds and then we'll get started. Again, thank you for joining. Okay, well, let's go ahead and get started. Good afternoon. I'm Dr. Madeline, your board certified OBGYN, author, and international speaker, and I'm so excited to be with you today. You know, over the last few weeks, I've been getting a lot of questions about irregular menses, so I figured that today we would spend some time talking about them. When we last got together, I spent some time talking about both birth control methods. And today, as we talk about irregular menses, one of the things we'll touch on with irregular menses is how birth control options can sometimes be used as treatment for irregular menses. So today, again, it's going to be irregular menses, 5 things that I think are important for all of us to know, especially women who are between the ages of as young as 10 when they might first start having their cycle, and the average age of menopause in this country is 51. So in all of those years that we're having our friend come to visit us every month, there are many things actually for us to keep on our radar that are important to consider. So what does it mean when someone has irregular menses? Well, irregular menses are actually more common than you might think. So they can happen most often when a young lady is first beginning her cycle, and the first 2 years of having your menses begin, it's not unusual at all for the menses to not come regularly every month as scheduled. Usually when we get past those first 2 to 3 years is when we start to see some more regularity in terms of how often our cycle comes. And when it comes regularly, women will see their cycles every 28 days, sometimes every 30 days, and their cycle will last usually about 4 to 5 days, and usually that flow is not too much. Hi, Dr. Banga. Thank you for joining. Thank you so much for joining. Good to see you. So that's one of the things that's important to know with irregular menses, that it's actually very common. Another period of time when oh, okay. Okay. Another period of time when it's common for women to see their menses become irregular is at the end of their lifelong cycle. So, so when a woman is getting close to that average age of 51, so the last like maybe 4 to 5 years before she sees her cycle for the last time, that's also a common period for her cycle to be irregular. So that's what it means when someone has an irregular cycle. And all those years in between, there can be a variety of things that happen. Most often, it's due to the hormones fluctuating. But when we talk about the 5 things to know, we're going to talk about some of those things. So what are the 5 things that I think are important for you to keep in mind as we consider irregular menses? So if you think that your cycle is regular, if it's not coming when you expect it to, if it's lasting for fewer days or for longer days, I think one of the most important things to keep in mind is that you keep an actual diary or journal so that when you go see your provider, your doctor, your nurse practitioner, or other provider, you can share with them what you mean when you say irregular. So that way, if you have it marked off, and this can be on a hard copy calendar, a paper calendar, or some people, many of my patients these days like to keep it on apps on their phone so that they can easily pull it up and be able to find the information that they need. When you have a diary or a calendar that you keep, you're able to have a clearer discussion or conversation with your provider about what you mean when you say irregular. And that way, both of you guys can be on the same page so that the workup and evaluation that is done is aligned with what it is you're describing. So that's the first thing, to keep a diary. And in that diary, you can describe what days your cycles come, if it's heavy some days, if it's too light some days, and you can really help your provider kind of hone in with you on what might be going on. So that's the first thing, keeping a diary or a journal. The second thing to think about when you have irregular menses is what some of the causes might be. And this is why it's important, if you think you have irregular menses, for you to try to be as specific as possible when you're talking with your provider. The causes can be due to a variety of things. For a lot of people, it's due to some hormonal change. But it can also be due to, again, when your period first starts when you're a young woman, when your period is ending toward when you're closer to menopause. It can be due to things like breastfeeding. It can be due to the presence of fibroids. It can also be due to outside of hormones that are reproductive tract hormones, thyroid hormones. If your thyroid hormone is underactive, it can cause you to have longer or heavier menses. And if your thyroid is hyperactive or more active than usual, it can cause you to have shorter, lighter periods. And so one of the things that'll happen when you go to see your provider is that you'll sit down and you'll talk about all the different things, and you'll be able to almost kind of brainstorm with your provider about what are some things that might be going on. One of the other common causes of irregular menses might be polycystic ovarian syndrome. And so, again, when you first start to have the conversation, we have this wide range of things that could be going on. And part of the things that we're trying to do when we sit down and talk with you is kind of hone in on what some of the things are that could potentially be going on with you. So the first two things we talked about are having a diary or a journal that outlines what your irregular menses are like, and the second thing we talked about are what some of those causes might be. So what's the third thing? The third thing to keep in mind when we're talking about irregular menses is what type of workup is needed to figure out which causes are contributing to your irregular menses. So workups can be based on a variety of things. Sometimes we will send blood work. Well, we'll first start by doing a complete history and physical. Hi, Dr. Jamila. Thanks for joining. Good to see you. So it's important that we do a complete history and physical. A history helps us understand everything that's going on. Again, we review the journal or the diary that you've kept to kind of outline what's going on with your irregular menses. We consider some of the causes, and then we work on what some of the things are for us to look at. So we might send hormones. Hormones that you might see include FSH, or follicle stimulating hormone. We might look at luteinizing hormone, or LH. Again, I talked briefly about thyroid stimulating hormone. We might look at that as well. Some of the other things that we might do, depending on what's going on and depending on what we find when we do your physical exam, we might also consider doing an ultrasound. A pelvic ultrasound allows us to look at or to see with the technology what's going on with your pelvic organs. So when we ask for a pelvic ultrasound, we're trying to get a good look at what's going on with your uterus. Do you have fibroids? Do you have thickening in the endometrial lining? Both of those things can contribute to an irregular menses. That also will let us see if you have any cysts on your ovaries. I mentioned that polycystic ovarian syndrome is one of the things that can cause irregular menses, and when we do an ultrasound, that's one of the things that we can also see. Sometimes we might see like a picture of your ovaries with not just one follicle, which we expect to see every month as part of your normal menses, but sometimes we can see multiple small follicles. And polycystic ovarian syndrome is one of the things that we consider when we're getting that ultrasound. So that's the third thing. So we've talked about three things so far, the top 5 things that we're considering when we think about irregular menses. Keeping your diary or journal so you can share it with your provider, thinking about the different causes, and then what the workup might look like to try to figure out what's going on. So another blood test that we usually will send if you have irregular menses, especially if your menses have been very heavy, is we send a complete blood count. That'll help us to see if your bleeding is to the point of you having anemia. If you have anemia, then of course one of the treatment options that we have in mind is some iron supplementation, so that we can actually help make sure that your blood count is as strong as it can be. Okay, so those are the first 3 things. The fourth thing, when we talk about treatments, we tailor the treatments to what the causes are that we've identified. Sometimes it might just be one cause. Again, most likely that's due to hormones. Sometimes it might be more than one cause. It could be hormones and fibroids, and so we have to adjust our treatment plan accordingly, always with each individual patient in mind. So again, that's why it's important to have that diary or journal, go through a complete history and physical, and then really try to hone in on what's going on. So let's say, for example, after doing the history and physical and having all of the conversations, one of the things we diagnosed with that was that the hormone, thyroid hormone level was abnormal. If that was the case, then one of the treatments that we would talk about would be treating you with a medicine that could help normalize your thyroid hormones. Sometimes we can engage with a specialist called an endocrinologist who can help us in that process, and sometimes it involves just starting with your gynecologist and then going on to a specialist as more fine-tuning is needed. And so that's one example of a way that we can treat irregular menses. Let's say that the cause is identified as polycystic ovarian syndrome. Then one of the treatments we would consider and think about would be possibly metformin or some medicine that could help regulate the hormones in the body so that the menses can be more regular. If the cause identified as fibroids, then fibroids have a range of treatments. Fibroids can be very small and maybe not need any intervention at all, and sometimes they can be larger. It's the larger ones that are in the inner part of the uterus, near the lining, that can contribute most to irregular bleeding. So we check for all of those things. If a fibroid is problematic and it's really large and it's right there in the lining of the uterus, we can do things like try some medicines to try to get the fibroid to shrink. We can do some things where we work with our colleagues in radiology, and we do something called a fibroid embolization, whereby they inject the material into one of the big vessels feeding your uterus, and we try to block the blood supply to the fibroid, and therefore it would shrink down. And we also consider other things, again, depending on what's going on in terms of treatments. I mentioned earlier that sometimes we can use birth control options for irregular menses, and that's absolutely the case. The main two birth control options that we think about when a woman has irregular menses, depending again on what the causes are, birth control pills, especially in some of my adolescent and younger adult women, and even into their 30s. If the hormone imbalance is such that a birth control pill trial for a month or 2 months helps to regulate that cycle, then that's a good thing. We consider that a win-win, because the patient gets to take a medication that's not too aggressive. It's considered like a minimal intervention. It doesn't require any surgery, and we can help to get that cycle to regulate. Another form of birth control that can be used when a woman has irregular menses is an IUD. So there are a couple of different types of IUD, but in general they fall into two categories. There's one that has no hormones at all, and then there's another group of category of IUDs that has some progesterone in it. And it's that second group, the group of IUDs with progesterone, that we will use if we want to try it as an option for someone with irregular menses. And it really is just, an IUD is a very small plastic device. And if someone has irregular menses, we can place that IUD into their intrauterine cavity and leave it there. And sometimes that IUD with hormones in it will be all they need to help to regulate their cycle. And those are some of the things that we try that involve birth control options. So it's always good to know what some of the different treatment options are, because as a woman, I find a lot of times when patients come in with this symptom of irregular bleeding, especially if it's gotten to the point of messing with their quality of life. And when I say quality of life, I mean, maybe you're going to that summer picnic and you have on a white outfit, and suddenly your cycle has come when it wasn't supposed to come, or it's heavier than usual, and you're thinking, goodness, I really want to try to help manage this so that I'm not out and about and having my cycle come at these unpredictable times. And so those are some of the things that are usually going on in a woman's life when she finally says, let me come in and check and see what's going on, because this is beginning to mess with my quality of life. So So that's the fourth thing in terms of irregular menses that we've talked about so far today. So again, when you think about irregular menses and 5 things to know that I want you to know from today's chat is 1, keeping a diary or journal. 2, trying to figure out what the causes are. 3, what are some of the different treatment options? And I'm sorry, I got a patient memo there, and so those are the different things that we think about. I'm sorry, 3 is workup, and then 4 is treatments. So 5, what happens when we've done the workup, we've identified a cause, we've implemented a treatment? The 5th step is follow-up, because we always want to make sure that there's been an improvement in what's going on with your irregular bleeding. So when you have tried taking the pill for a couple of months, or if the thyroid hormone was abnormal, if you've taken the medicines for a couple of months, or if the issue was fibroids. Hi, Dr. Carolyn. Thanks for joining. It's great to see all of you, fellow medical mogul sisters. And so when you're having that follow-up, you basically are examining what happened after you started one of those treatments, whether it was taking the pill, whether it was placing the IUD. And we want to know that our patients are doing better. Again, when you have irregular menses, it can sometimes be a quality of life issue. And so when we come in and we talk with you and we do your exam, we understand and we feel what's going on. And so it's absolutely our goal to help those irregular menses resolve and for it to no longer be a quality of life issue for you. And so that 5th thing is really important, because when you follow up, you help us know whether or not what we've tried has worked and whether or not we need to try something else to really get to a good result, for you to be able to have the result that you need. Hi, Dr. Carolyn. Hi. So those are the main things I wanted to talk with you about today in terms of irregular menses. Again, let's go over them again. 5 things that are important to keep in mind if you have irregular menses, which means that your cycle is, it may not be coming every 28 days, which is what happens for most women. It might be lasting more than about 5 to 7 days. It might be heavier than usual. It might be lighter than usual. So those are some of the things that can happen in the range of what goes on when there are irregular menses. If you have any of those things, it's definitely important to reach out to your provider. The 5 things again to keep in mind: 1, a diary or a journal of when those irregular menses are happening, what days they're happening, what the flow is like, whether or not you soak through pads. If you are having menses that are so heavy that you're soaking through pads, that actually becomes a very different scenario and can sometimes be emergent, depending on how heavy your bleeding is, depending on how anemic you become, depending on, if you have to go into an emergency room. So that diary or journal, that first thing, is very important. The second thing we talked about in terms of things to know, top 5 things to know, are causes, some of the different causes of irregular menses, whether it's hormonal imbalance, PCOS, fibroids. Those are some of the things we would work up when you would come into the office. The third thing that we talked about is what that workup would look like. When we do the history and physical and we've tried to rule in or rule out some of the causes, we choose things to follow up on based on things we want to look at and hone in on, whether it's blood work, whether it's an ultrasound, etc. So after those 3 things, what's the 4th thing? The 4th thing is treatments. What are some of the different options that we have to treat the things that are going on? Treatments are based on what findings we get from the ultrasound, from the blood work, from the history that you give us, and we approach treatment plans that are very specific to you to try to get the best outcome for you. And the 5th thing is follow-up. So we've done all those previous 4 things and we've tried a treatment, and we will usually follow up with you in about 6 to 8 weeks to make sure, or to see if you're having an improvement, to make sure that the irregular menses are no longer messing with your quality of life, because none of us want that, right? Everyone wants to be able to live their lives and not necessarily have to shift too much with some of the things that can happen when a woman has irregular menses. And so those, I think, are the most important things to keep in mind when you're having irregular menses, if you want to start to begin the process of understanding what's going on and what some of the ways are that you can ensure that your provider has the information they need to help take great care of you. Because ultimately, that's why we're here, to help take great care of you based on what's going on specifically with you. So, I want to thank you guys for joining today. I'm going to just check and see if there are any questions in the box. And if not, we're going to sign off. Sorry, Facebook Live sends these different comments. And I'm not sure how to, I'm learning to try to figure out how to do the different things. Okay. All right. Thank you, Dr. Banga. Thank you. I'm glad you were able to join. I'm glad you liked the information. And hi again, Dr. Terralon and Dr. Jamila. So, okay. Well, thank you guys. I'm excited that we were able to get back to Facebook Live today. I skipped a week last week. I had a lot going on, and I look forward to seeing you again next weekend, next Sunday. Thank you so much. If you have any questions after the session ends, feel free to inbox me, and I'm very happy to address any comments you might have. All right. Y'all enjoy the rest of your Sunday. Have a good one. Bye-bye.